Hello and welcome to BNS Nature Ways. Life is not merely to be alive, but to be well. And to accomplish this, Ayurveda is the only ancient science that can help. Ayurveda is known as the science of life, and it in reality gives you with a life that is healthier and better in all aspects. Our human body is made up of cells. The cells travel with iron and hemoglobin, which is a protein that helps to carry oxygen to the bloodstream of our organs all through our body. When there are not enough healthy red blood cells to carry oxygen to our body organs, our body develops a condition called anemia. When someone develops anemia, they are said to be anemic. Being anemic might mean that you feel more tired or cold than you usually do, or if your skin seems too pale. This is due to our organs not receiving the oxygen they need to do their jobs. There are several different types of anemia, but each of them causes the number of red blood cells in our blood circulation to drop. Red blood cell levels are low due to many reasons, like our body does not make enough hemoglobin, that is the low hemoglobin count, or our body makes hemoglobin but the hemoglobin doesn't work correctly, or our body does not make enough red blood cells, or our body breaks down the red blood cells too quickly. Anemia affects more than 2 billion people globally, which is more than 30% of the total population. It is especially common in countries with few resources, but it also affects many people in the industrialized world. So who can likely develop anemia? Yes, anyone. Anyone can develop anemia. In women, blood loss during monthly periods and childbirth can lead to anemia. This is especially true if you have heavy periods or a condition like fibroids. In children aged 1 to 2, the body needs more iron during the growth spurts. Infants may get less iron when they are weaned from breast milk or formula to solid food. Iron from solid food is not as easily taken up by the body. People over 65 are more likely to have iron-poor diets and certain chronic diseases. Let's have a look at the signs and symptoms of anemia. Several signs and symptoms occur in all types of anemia, such as fatigue, shortness of breath, and feeling cold. Others include dizziness or weakness, headache, sore tongue, pale skin, dry skin, or easily bruised skin. Unintended movement in the lower leg, that is restless leg syndrome, and fast heartbeat. Anemia can have other effects on our body in addition to feeling tired or cold. Other signs that you might be lacking in iron include having brittle or spoon-shaped nails and possible hair loss. You might find that your sense of taste has changed, or you might experience ringing in your ears. Different types of anemia may lead to other serious problems. People with sickle cell anemia often have heart and lung complications. If you have anemia that is not treated, it could lead to arrhythmia, that is irregular heartbeat, an enlarged heart, or heart failure. You are also at a great risk of getting infections and becoming depressed. You might have heard that iron deficiency is linked to chewing ice, which does not happen. Chewing ice is a sign of pica, a condition that includes eating things that are not really food, like chalk or dirt. So pica is also a sign of iron deficiency. It is often seen in children with anemia. So how does anemia affect children? It is more important for children to have enough iron and other nutrients in their diets to prevent anemia and the related problems with lack of attention, delayed development of motor skills, and problems with learning. In older children, you need to pay more attention to signs of anemia during growth spurts and menstrual cycles. In older adults, anemia might have even more impact in causing confusion or depression. Weakness may make walking more difficult. Anemia may shorten your lifespan if you are older and it is not treated. Having enough iron may also be a factor in weight issues. Studies have found overweight people might lose weight if they address low iron in the blood. You might experience unintentional weight loss along with anemia if you have other conditions such as cancer. People who have had weight loss surgery might become anemic due to vitamin and mineral deficiencies. Let's see, how does anemia affect pregnancy? Iron deficiency during pregnancy increases the chance of complications, such as premature birth. After the birth, studies have indicated that babies born to women with low iron levels have a higher risk of low birth weight and problems with their own iron levels. If you're pregnant, you're more likely to develop iron deficiency anemia. Your unborn baby relies on you for iron and other nutrients. Many women who are pregnant take iron pills to prevent anemia. To make sure that you have enough iron for you and your baby, eat well-balanced meals that include iron-rich foods and foods that provide B12 and B9 vitamins. Follow your healthcare provider's instructions for taking vitamins and adding iron to your diet. Finding out that you have anemia is just the beginning. Finding the cause of anemia will lead you to the best treatment. Let's have a look at the causes of anemia. The most common cause of anemia is low levels of iron in the body. This type of anemia is called iron deficiency anemia. Our body needs a certain amount of iron to make hemoglobin, the substance that moves oxygen throughout our body. However, iron deficiency anemia is just one type. Other types are caused by diets lacking in vitamin B12, or you can't absorb or use vitamin B12, like pernicious anemia. Diets lacking in folic acid, called folate, or our body can't use folic acid correctly, like folate deficiency anemia. Inherited blood disorders like sickle cell anemia or thalassemia. Conditions that cause red blood cells to break down too fast, like hemolytic anemia. Chronic conditions causing your body to not have enough hormones to create red blood cells. These include hyperthyroidism, hypothyroidism, advanced kidney disease, lupus, and other long-term diseases. Blood loss related to other conditions such as ulcers, hemorrhoids, or gastritis can also cause anemia. One can get iron deficiency anemia from bleeding, either from losing a large amount of blood quickly, for instance in a serious accident, or losing small amounts of blood over a long period of time. The body loses more iron with blood loss than it is able to replace with food. This can happen to women having heavy menstrual periods or in people who have inflammatory bowel disease. Iron deficiency anemia can also be caused by not getting enough iron in the diet or needing more iron than you did previously, for instance during pregnancy or illness. Some types of iron deficiency anemia are called by other names related to the cause, such as anemia of chronic disease, also called as anemia of inflammation or acute blood loss anemia. Some kinds of anemia, such as those that are inherited, cannot be prevented. However, you can prevent anemia caused by iron deficiency, vitamin B12 deficiency, and vitamin B9 deficiency by eating well. This includes eating a diet with enough foods that provide iron and these vitamins, along with vitamin C food sources to help with the absorption, or taking iron food supplements. While some types of anemia are short-term and mild, others can last throughout a lifetime. There are several ways to help manage anemia, including following a healthy diet, drinking enough water to stay hydrated, exercising regularly. However, if you have been weak, you should begin exercising cautiously. Avoiding exposure to chemicals that set off anemia. Washing your hands often to avoid infection. Taking good care of your teeth and going to the dentist regularly. Talking to your doctor about any changing symptoms, keeping track of your symptoms by writing them down. With anemia, making good food choices is important. Eating junk food means you are getting calories without nutrients. You also have to consider other medical conditions that you have when you make your food choices. In general, you should eat iron-rich foods and foods that provide vitamin B12, B9 and C. This means that you can enjoy plenty of good food that is for you, whether you eat meat or not. You can get iron from plant sources like lentils, spinach and pistachios. You can get iron from protein sources like lean beef and turkey. Whole grains and dark leafy vegetables are good sources of B vitamins. Some foods are even fortified with iron. Citrus fruits, berries and other vitamin C containing foods like peppers and tomatoes improve iron consumption. Now let's have a look at a few natural home remedies which are quick and easy to make and very beneficial in anemia. The first natural home remedy is using apple juice and beetroot juice. Apples are rich in iron and beetroots have folic acid, fiber and potassium. Take 1 glass of apple juice, mix it with 1 glass of beetroot juice, add honey to taste. Take this drink every day. This drink is high in iron content and thus helps in increasing the hemoglobin levels in our body. Honey contains high amounts of iron, manganese and copper which are very essential for building hemoglobin. According to ancient texts, honey is a traditional cure as well as prevention for anemia as it helps in maintaining the optimum level of red blood corpuscles and hemoglobin. The next natural home remedy is using sesame seeds and honey. Sesame seeds are loaded with iron, copper, zinc, selenium and vitamin B6, folate and E. Regular addition of black sesame seeds are proven to improve the hemoglobin levels and promote the absorption of iron. Take 1 teaspoon of sesame seeds, soak them in water for 2 hours. Then strain the water. Crush the sesame seeds to make a paste. Add 1 tablespoon of honey to it. Mix it well. Have this paste 2 times a day. Along with these home remedies, also make sure you expose yourself to the morning sun and avoid tea and coffee as they hamper the absorption of iron. Thank you for watching the video. Wish you a healthy life forever.